Good morning, good afternoon, good evening, and a warm welcome to all of you joining us around the world for this COVID-19 briefing from the WHO Regional Office for Europe here in Copenhagen. Warm welcome to you all. Before I hand to our Regional Director, Dr. Kluge, let me please remind you who else is online with us today. Joining us on the panel, as always, Dr. Catherine Smallwood, our COVID-19 Incident Manager at the WHO, from the WHO Health European Emergencies Programme. And also we're joined by Dr. Siddhartha Datta, who is our Programme Manager, our Unit Lead on Vaccine-Preventable Diseases and Immunisation. So thank you again to those two for joining us, alongside our Regional Director, who I will pass now the floor over to make a short statement.
Good morning, good afternoon, добрый день. COVID-19 cases and deaths are declining. Weekly cases in Europe have gone down from a plateau of 1.7 million during mid-April to just close to 685,000 new cases last week. This is a 60% decrease in a month. But this progress is fragile. We have been here before. Let us not to make the same mistakes that were made this time last year, that resulted in a resurgence of COVID-19 and saw our health systems, communities and economies once again bear the full force of this pandemic. We learned our lesson the hard way. We are heading in the right direction, but need to keep a watchful eye on the virus that has claimed the lives of nearly 1.2 million people in this region. That is the equivalent to the population of Brussels in Belgium. In several countries, there are pockets of increasing transmission that could quickly evolve into dangerous resurgences. Last week, case incidence remained high in 8 countries in the region, at over 150 new cases per 100,000. So the pandemic is not over yet. In coming months, increased mobility, physical interactions and gatherings may lead to more transmission in Europe. If social measures are eased, as most countries across the region are currently doing, the efforts on testing and sequencing, isolation, contact tracing, quarantine and vaccination need to be redoubled to stay in control and ensure that trends remain on a downward course. As several countries in our region are currently scaling up testing for citizens to access cultural, social and entertainment venues, we must remember that there is no such thing as zero risk. Alongside this, only 23% of people in the region have had a single dose of vaccine, while 11% have completed their vaccine series. We still have some distance to cover before those eligible in the region receive their vaccine doses. Neither testing nor receiving vaccines is a substitute for adherence to measures such as physical distancing and mask wearing in public spaces or healthcare settings. Most of us are still susceptible to the virus and not vaccinated yet. Right now, in the face of a continued threat and new uncertainty, we need to continue to exercise caution and rethink or avoid international travel. Vaccines may be a light at the end of the tunnel, but we cannot be blinded by that light. The new variant of concern, B.1.617, first identified in India, has now been identified in at least 26 countries out of the 53 in the WHO European region, from Austria to Greece, Israel to Kyrgyzstan. Most cases have a link to international travel, but onwards transmission is occurring. We are still learning about the new variant, but it is able to spread rapidly and displace the B.1.1.7 lineage that has become the dominant lineage in Europe. Allow me to emphasize that all COVID-19 virus variants can be controlled in the same way, with public health and social measures, and that all COVID-19 virus variants that have emerged so far do respond to the available approved vaccines. Last week, we convened health ministers from all 53 member states to take stock of vaccination uptake and strategize in order to extend the benefits of available vaccines to more people in the region. Vaccination uptake among those older than 80 in our region is now 75%. Prioritizing older adults for vaccination, including those in long-term care facilities, is bearing fruit. The public health impact is clear. Whilst new cases began to decrease across all ages from mid-April, rates have fallen quickest in the oldest age groups. Those over 80 are now the least represented in new cases across the region, having been the most represented at the beginning of 2021. So the data speaks for itself. Weekly incidence among those older than 80 years in the region fell from 27.4 cases per 10,000 in mid-December 2020 to 6.2 in the first week of May 2021. In the same age group over the same period, weekly mortality fell from 4.6 per 10,000 to 0.9. Such is the value of vaccines. Every time an individual is vaccinated, every time you choose to wear a mask and keep your distance, we do make a major advance against a virus that will continue to reap rewards if we lower the guard. However, let there be no doubt, thanks to your efforts, we remain on track to assign this pandemic to history. Thank you.
Thank you very much, Regional Director, and thank you all again to the journalists that are joining us online today. Very grateful for your attendance. We have some journalists who've sent us questions in advance, and I'm going to go immediately to one of those, over to Oksana Naralenkova from Komsomolskaya Pravda outlet. And Oksana asks, what are the main strains of coronavirus currently circulating in Europe? What are their dangers and what vaccines are effective against them? I think the Regional Director referred to this in his statement, but I'll go first over to the Regional Director and then to Dr. Catherine Smallwood.
Thank you, Oksana. So currently there are about 4 main variants of concern circulating in the WHO European region, and WHO has been monitoring this since January 2020. For the time being, we can say that all the 4 variants do respond to the vaccines made available as of today. But the best way to counteract is to speed up the vaccination rollout and meanwhile to do what we call do it all. The 3 W's of watch your distance, wear the masks, wash the hands, ventilation indoors, and to avoid crowded spaces and big gatherings. Thank you.
Katie, please.
Thank you very much for the question. And as the Regional Director says, we're continually tracking both the variants of concern and variants of interest that we're tracking because they might become variants of concern if we have sufficient information to do so. As the Regional Director said, we're currently looking at 4 variants of concern in the WHO Europe region. One of these is the B117 lineage. So this is the variant that was additionally identified in the United Kingdom. And that has in fact become the dominant variant in the European region. In fact, accounts pretty much for most of the transmission occurring. But recently we've seen that there are several areas within the region where this trend might be changing. And that's what we're keeping a very close eye on, of course, with the designation just in the past 10 days or so of the B1617 variant of concern that first originated or first was identified in the Indian subcontinent and now has been reported in at least half the countries across the European region to some extent. Thank you.
Thank you very much, Katie. I've got a follow-up question regarding this, actually, if I could go back to you, Katie, from Casey O'Riordan from News Talk in Ireland. And Casey asks, can you comment on the transmissibility of the Indian variant B1617.2 compared with other strains? The Irish Health Minister has this morning described the variant as very worrying and said that it could be 50% more contagious than the UK variant. Could you comment to that, please, Katie?
Yes, I can. And we're still very much learning, as the regional director said. So it's very difficult to say with any certainty how transmissible this particular variant is. I'd just like to point out as well that there are 3 different sublineages in this particular variant of concern. And one of them, this is the sublineage 2, has been shown to at least have a capacity to spread quite quickly in the presence of B117, that is the dominant strain in the European region. And we've seen that in several parts of the United Kingdom, but we've also seen it in other countries in the European region where initial cases that were potentially travel-linked have been able to spread onwards and have developed into small clusters and sometimes into larger clusters. So this is why it's of concern. We're tracking it very closely. We're learning about it. We're pulling as much information as we can together in order to be making some more specific statements around its characteristics, both in terms of transmissibility, but also in terms of its ability to evade any immunity that we have. So we're looking into these characteristics on an ongoing basis, and we'll make any updates to our findings in due course.
Thanks, Katie. And regarding, sorry to keep you on the seat, but regarding how we look into this and how does WHO evaluate the threat of the Indian variant upon Europe and the whole world? This is a question that is coming from David from Editosphere, which is also related to this. So just to close the loop, can you comment on that as well, please?
So we rely on several different streams of information and dialogue with member states specifically. At the regional level, we have regular reporting through the international health regulations mechanisms, where countries actually report to us where they have the first few cases of any new variants of interest or variants of concern. They share with us also information with regards to the proportion of sequences that are being captured in their surveillance systems so that we can look at the trends of those different variants of interest and variants of concern over time as they spread or as they take over or displace other variants that are circulating. But we also have regular fora where we bring together member states at the regional level. And in fact, these happen every Thursday morning. We have a several-hour meeting that brings together several member states across the European region to share experiences, to talk about the data that they have, the findings that they have from their own investigations, both at the epidemiologic level, but also in the laboratory. So we pull together that information, and that feeds up into the global mechanisms. And there's a global virus evolution working group that pulls together information from across the world in order to make assessments and determine whether new variants that are identified qualify as either variants of interest or variants of concern. And then we put together recommendations on the basis of those assessments.
Thank you very much, Katie. Next, I'm going to our journalists that are joining us live. Kate Kelland, Reuters. Kate, please go ahead with your question.
Thank you. Can you hear me?
We can. Please go ahead.
Yes. Thank you so much. Sorry to keep going on the variant questions, but there seems to be some suggestion that this variant might have a particular risk for children. And I wonder whether you have any information or data to suggest that that's the case, whether it's spreading more rapidly or it's causing worse symptoms or higher levels of symptoms in children. And if so, why might that be? Would it simply be that children may have been not infected or not vaccinated previously?
Thanks very much, Kate. I'll put that over to Katie Smallwood, please, Katie.
Thanks, Kate, for the question. And it's a good question. And most of that information is currently coming from countries where they're seeing an increase in the prevalence of this particular variant of concern. Now, I would be cautious at the moment to make any statements that children are more affected. What may happen is that as a variant takes over quite quickly, or as any of the SARS-CoV viruses accelerate in terms of transmission, we may see more children being affected. And we in fact saw that during the emergence of the B.1.1.7 variant of concern. There was a lot of attention as to whether children were more affected. But in fact, it was simply a product at the time of the conditions where the virus was spreading. And at that time, it was a situation where schools were open and other measures were being placed at the community level in the United Kingdom, for example, whereby it favored transmission around school settings. And so there was a bias. And over time, that in fact corrected itself naturally. And we saw no difference in terms of the age groups that were affected by the virus. So of course, we're taking any information that comes in very seriously and taking a very good look at it. But at the moment, we don't have any data that signals, at least in the European region, that there's been an increase in cases among children due to this particular variant of concern. What we have seen is over time, and as the regional director noted, with the uptake of vaccination in older age groups, a significant growth in younger adults and of course in older children. So that's something that we are very aware of and that we're monitoring, but there's no indication that it's due to this particular variant or any other variants of concern.
Thank you very much, Katie, and thanks, Kate, for the question. We will next go over to Stefano Valentino from the European Data Journalism Network. Welcome back, Stefano. Please, your question.
Can you hear me? Hello? Yes. Now you can hear me. Hello?
Yes, we can hear you. Please go ahead.
Yeah, so I have a question on legal issues. As you know, there is an ongoing debate now on the possible support by the US and Western countries to the waiver on intellectual properties on vaccines. I would like to know if you are in favor of this waiver and you feel that liberalization of patents would rather contribute to boost vaccine production against variants, or it would rather discourage producers to invest further to produce vaccines, given the fact that liberalization would somehow reduce the possibility to make profits for pharmaceutical companies.
Thanks very much, Stefano. So I'll first go to the regional director on this and then over to Siddhartha Datta. This regards the waiver of patents, vaccine patents.
Thank you, Stefano. So we definitely welcome those discussions. It's very, very healthy that this being discussed. Is also nothing new. What is our goal? Our goal is equitable access to the COVID-19 vaccines and by extension to any life-saving treatment. And in this case, and particularly for the people who are most exposed, the healthcare workers, and the most vulnerable, the elderly people and people with underlying conditions. If this is one way to go, that is welcomed. At the same time, here in the WHO European region, we attach a lot of attention to public-private partnerships. So we do understand that the vision is equitable access. So we need a win-win situation. First and foremost, a win for the person, a win for the patient, and also at the same time, an incentive for the industry to keep innovating. Definitely what is needed is that the production capacity of the COVID-19 vaccines need to be drastically beefed up, and the speed of the vaccination rollout needs still to gain more traction. But we do acknowledge that there are several efforts underway, not at least by WHO globally and also in the region by the European Commission. And we continue to work also, for example, with the Russian Federation on the Sputnik V on the emergency use listing. Thank you.
Thank you. Dr. Siddhartha Datta, could I ask you to chime in on this question of Stefano's?
Yeah, thank you so much, Rob. Stefano, thank you. Just continuing from where Regional Director outlined the different steps, we strongly feel that it has to be a comprehensive understanding and comprehensive approach in addressing the entire issue around vaccine production and vaccine distribution. It cannot be one only instrument that will beef up the production, but as you have heard from the Regional Director has outrightly mentioned. Intellectual property rights is just one part of this entire big puzzle. The waiver of which was declared by the United States. It's just one step around this process. The important element at this point of time is efforts being made by both manufacturers as well as the governments or the host governments to beef up the production. For that, this is only an element around this whole process. The other element, which also should be part of it, is the ingredients of the vaccine production. That is also a big implication in ensuring that the world gets enough doses so that the vaccine production can be beefed up. Sharing of the technologies with the developing countries or countries which have got its own research and also the production volume is also an important element moving forward. So just to summarize is that these should not be seen as one of its element. This has to be a comprehensive approach moving forward, including what the regional director has already outlined. Thank you.
Thanks very much, Siddhartha. And a reminder to those journalists joining us online today that in the Zoom, you may raise your hand and may drop your question into chat, which I have open also in front of me here for us to respond to. So I'm next going to go over to a question that we received in advance from ITAR TASS, media outlet from the Russian Federation, from Irina Dergacheva. Do you think that the pandemic has changed the global vaccine market in the sense that politics, competition, and greed to the great extent made people forget about cooperation and helping the weak? I'm first going to put that question over to the regional director and then back to you, Siddhartha.
Spasiba Bolshoy, Irina. That's a phenomenal question and one which is very, very close to our heart. In fact, that's the reason why I decided about half a year ago to establish the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics. And Professor Mario Monti, the chair, is going to speak this week to the G20 and G20 Global Health Summit on some of the recommendations. And one key element includes exactly that we need a renewed international governance for the WHO European region. The governing body board, which met 2 days ago, agreed to look into a Pan-European Health Security Council, which would reflect a very representative sample of member states at the level of heads of government, to look in this whole issue of international collaboration and better preparedness. In fact, globally, if we speak globally, as of the 4th of May, 29% of the population in high-income countries versus 1.4% in low and lower middle-income countries of the population received at least one dose. So this inequity is definitely there. That's why mechanisms as the COVAX and the ACT-A accelerator are so important, because they are really the guardian, let's say, to have equitable access. From our side in the Pan-European region, we convened the Ministers of Health of the 53 member states last week to share together the lessons from the vaccination uptake so far. I myself have also appointed a special advisor to the region director on COVID-19 vaccination rollout to work with COVAX, but also look into possibilities and real possibilities that the European Union may have a access going towards the summer of vaccines, and what does it mean in terms of sharing, whether it's donating or reselling, and working closely on a policy in that regard, not only for the Pan-European region. We have a global outlook. We know what's happening in India, in Nepal, in other countries. So we try to pave the way here. I have been seeing that solidarity has been growing throughout the pandemic. And I always say that international solidarity and national responsibility are not mutually exclusive. They're two sides of the same coin. But what should be avoided is that younger, healthy people are being vaccinated in countries, while in other countries, the healthcare workers, the elderly people, the people with underlying diseases didn't have one single dose. Thank you.
Thank you very much. I go to Siddhartha Datta and then to Katie as well, please. Thank you.
Thank you. Thank you, Irina, for that question. And I just wanted to highlight a couple of elements on this. One is with this COVID-19, the research and development around the COVID-19 vaccines, COVID-19 diagnostics and therapeutics actually has brought the world a bit closer and not far away. The access to COVID-19 tool accelerators provided an opportunity for the entire globe to come for a common cause. And we are just talking about several of those vaccines only when we have gone past a year since the detection of the last virus. So I think this is an unprecedented effort made by the global community, both by the researchers, the host, the member states, and the partners around it. So I think we just wanted to start on that point. However, I think the diagnostics, therapeutics, and vaccines provided also a platform for public and private to interact, providing that opportunity wherein we all can come together around a global public good, calling out on the global solidarity. The other part which you have heard the regional director has mentioned, the COVID-19 also provided another phase. We all are thinking about others. Sharing of doses provided a big platform within the WHO European region where we have seen a demonstrable effort made by the countries to share their doses with the neighboring countries. And I think this all should be seen as a positive mechanism upon which we should build upon the public health domain of tomorrow's. The last part I wanted to also highlight here, when we are all talking about research development, we are all talking about dose sharing and getting the doses or getting access to the vaccine doses in a country. Getting the vaccine dose access or keeping the vaccines in the shelf or keeping the vaccines in the national capital will actually not bring any effect or the public health impact of this entire public health good. Efforts are being made in the country, and we also have seen several of our member states helping each other to ensure that the vaccine delivery is optimized in a country. The role played by the European Union is exemplary in this effort in terms of helping the Eastern Partnership and the Western Balkan countries of our region. Thank you so much.
Thank you. And Dr. Catherine Smallwood, please.
I just wanted to broaden this a little bit because this is such a huge topic and so important. And I just wanted to highlight, as the regional director said, over the course of this pandemic, we have seen huge acts of solidarity from one country to another internationally between regions, both in terms of vaccine, but also in terms of sharing medical supplies, medical teams, transferring patients from one country to another. And most recently, we've seen that in the huge solidarity to India from many European member states over the past several weeks. But the point is that we need to move away just from solidarity during devastating situations to solidarity in order to prevent those situations from happening in the first place. And I think that's the key message here, is that this is in our interest. It's not just altruistic solidarity. It's in each of our interest to prevent devastating COVID-19 situations in any country, because at the end of the day, those represent a risk to us all. Thank you.
Thanks very much, Katie. Now, I'll go to Juan and then to Gerardo. Juan Palop from EFE Berlin has joined us online and has asked in the chat, what's your opinion on the vaccination certificate that the EU is working on in order to facilitate travel and tourism this summer? Do you think it is a mistake to promote tourism with this tool in the middle of the pandemic? So I'll go to the regional director first and then over to Katie. Thank you.
Right. So a number of points here. Everybody has the right to essential travel as our principle, irrespective of their COVID-19 vaccination status. From the very beginning of the pandemic, in line with the international health regulations, WHO has been consistently recommending the countries to put in place COVID-19 mitigation measures while minimizing interference with travel and trade. So the principle is that the principal vaccination for COVID-19 should not be a precondition for travel. Why? Because of the equity point that we wouldn't like to see that vaccines in a context of limited supply are prioritized for, let's say, non-priority groups. At the same time, we do understand, I'm traveling around the countries, and that for several countries in our region, tourism is very, very important. In fact, it's a vital lifeline. So that's why it comes back to the point that we made again. There is the need for solidarity to drastically scale up the pace of vaccination and to leave no one behind. So to aim to get everyone vaccinated, starting with those most at risks, and allow us all to move across countries and borders. And when countries are putting requirements in place based on studying the situation of the country of origin, of the individual, that this is being done in a standardized, harmonized way. That's important. That's why we don't call it a COVID-19 passport, but a certificate. And preferably a digital certificate is very, very important to gather the information on vaccination status, the coverage, the effectiveness of the vaccine, the testing, etc. And of course, maybe a final point, that access to affordable testing is very, very crucial, especially for the people who meet the definition of a contact or a case, the affordability of testing. Thank you.
Thank you. And can I ask Dr. Katie Smallwood to make a few points here? Thank you.
I don't have much to add. Just to state that WHO's recommendation is that countries take risk-based decisions in terms of the requirements that are put in place. And many countries do have requirements in place for international travel that include testing or that include quarantining in some situations. And bringing together information around travelers is an important way to actually facilitate the travel for those travelers and clarify the requirements for each person. In terms of right now, as the regional director said in his statement, we're at a moment where there is high transmission in several countries in the European region, high transmission in many pockets within countries, and we're also in the face right now of a very uncertain threat, which is the emergence of a new variant of concern. So this is not a moment to throw caution to the wind. It's very much a moment to proceed extremely cautiously, to wait a few weeks until we understand better the situation with this new particular variant of concern, and to proceed cautiously, rethink every movement that we take. As countries reopen, both at the domestic level and at the international level, there will be more transmission, especially in areas where vaccination coverage is not very high yet. So we will need to redouble all efforts in terms of the implementations of those disease control measures that we have at our disposal: testing, sequencing, isolating cases, contact tracing, quarantining contacts, and all of the individual measures that we have in place.
Thank you very much, Katie. Next, I'm going to go to Gerardo D'Amico from Rai News 24. Gerardo.
Yes, thank you. Thank you for the opportunity. You have asked in part about a question I'd like to submit about vaccination passport for tourism, of course. You think this pass can be granted with a single dose of vaccination?
Great. Thanks very much, Gerardo. Very clear. Can a passport be granted with a single dose of vaccination? I'm going to go over to Siddhartha Datta to respond to that. Thank you, Gerardo.
Thank you, Gerardo, for that question. So just again, if you allow me to take the point where the regional director and Katie ended on the passport first. WHO is, we need to differentiate between these two terms very much. One is a vaccination certificate, which includes an individual's receipt of the vaccine. I mean, they should get a proof of vaccination and themselves, either it can be a paper-based or a digital. in terms of the passport, which means it can be used for travel. You have heard the response from the regional director and Katie. So just wanted to highlight that. In terms of the vaccine doses, single dose or 2 doses, we have to, the current WHO recommendations of all vaccines are 2 doses, other than the Johnson & Johnson, the Janssen vaccine, which is of 1 dose. These 2 doses of vaccines that WHO has provided recommendations on are based on the clinical trial results that we have seen and were submitted by the manufacturers for the assessment of the safety and efficacy of the vaccine. The strategic advisory group of experts have reviewed the available evidence from the clinical trials and have recommended that all these vaccines should be having a 2-dose schedule. There are additional studies that are ongoing at this point of time to understand the efficacy of the vaccines, of the current vaccines, for a less number of doses, which is 1 dose. But still, those data are very preliminary, and we'll be looking into those data very closely. So in terms of the vaccine, whether it can be 1 dose or 2 doses is guided by the data from the clinical trials that we have reviewed, and WHO will be able to provide guidance to the member states on the efficacy of the vaccines only after those doses are, the data is reviewed from the clinical trials. Thank you.
Thank you very much, Siddhartha, and thank you for your question, Gerardo. Next, I'm going to move to Camille Bass-Wallet from AFP, who has submitted a question in advance. Restrictions are easing over Europe as vaccination campaigns speed up. Is the timing right, or is it too soon? Now, the RD said a few words about this in an opening statement. I'll first go to the regional director, to Hans, and then to Katie.
Thank you, Camille. Yes, maybe to refer to the statement indeed. We understand that we measure a lot with our behavior insight surveys, the pandemic fatigue and frustration by the population in the pan-European region and globally. Then there is the tourism, etc. So the principle remains that if social measures are eased, number one, that people still take caution, like the distancing and definitely masks in crowded places, washing the hands, what we call do it all. And of course, very important, let's just repeat again, to take the vaccine when your turn is there. And at the same time, to redouble the efforts to prepare the health systems further on testing, genomic sequencing. Yesterday, we had a meeting also with the director of the European Centre of Disease Control to strengthen the sequencing in the Western Balkan. Also on isolation, contact tracing, and quarantining. Thank you.
Thank you. Katie?
Yes, just moving on from that. As most countries in the European region are now gradually easing social measures. And as they do that, they need to reinforce the public health measures. If that doesn't happen, cases will increase, because as measures are eased, people will meet together in restaurants, in venues, in public places. People will be traveling more, and interactions will drive transmission of the virus. So that means that in order to prevent a surge in cases, the public health measures, the individual measures that we have need to be reinforced. At the same time, there are several major mass gatherings that are occurring in the European region in the coming months. These, we know, can act as amplifying events, and all caution needs to be placed around these events should they occur to ensure that they don't contribute to a surge in cases in the European region. So yes, these are very, very clear signals to us that we cannot rest. We need to continue our efforts. The pandemic is not over. We saw what happened during the summer period last year, and we cannot afford to let that happen again.
Thanks very much, Katie. And Siddhartha, would you like to add any aspects around vaccination on this?
Thank you so much, Rob. I'm happy to do that. I think we also need to keep in mind a couple of facets around the vaccination rollout. While all 53 member states of our region have rolled out the vaccination, you have heard the regional director outlining the difference between the countries. The coverage uptake has been uneven. But if you look into within a country, I think this is also an important facet that we bring here. But the vaccine doses are still limited. We have talked about that in the previous question as well. Productions are being beefed up, the efforts are being made. But within a country, not everybody in a country will be receiving a vaccine even at this point of time. This can also be within a community, that within a community or even within a household, not everybody would be receiving and is not eligible to receive the vaccine. So I think the vaccination will still remain uneven in a community or in a country. So those conditions are also need to be kept in mind when we talk about using vaccination as one of the parameter. I think we have discussed it in the past as well, that the easing of restrictions, vaccination should not be seen as only one yardstick to do it. It has to be made evidence-informed with other public health and social measures that are in place. Thank you so much.
Thank you very much, Siddhartha. So before I close this press briefing, I'd like to invite the Regional Director to make a few final remarks.
Thank you. So on behalf of WHO, I would like to express our sincere condolences to the victims and the families of the victims, the injured, and all people affected by the conflict in Israel and Palestine. There is never a right moment for a conflict, but this happens as the world is fighting a global virus, a powerful virus, and when the health systems are already stretched beyond capacity. And the protection of health facilities and health workers is very, very important. It is also essential that the urgent humanitarian needs of those affected by the conflict are met immediately, and that life-saving referrals of patients and timely healthcare must be unhindered. And the topic will be discussed is on the agenda of the World Health Assembly next week, beginning of the 24th of May. Thank you.
Thank you very much, Regional Director. Thank you, Hans. Thank you, Katie. Thank you, Siddhartha. I'd like to close this press briefing now and thank everyone that has called in and joined us today. As always, we'll be sharing the Regional Director's statement. We'll also be sharing a Q&A on the variants shortly after this because we appreciate there's a lot of interest and inquiries regarding the variants. We'll be posting these alongside a recording of this briefing shortly. As always, from all of us here, stay healthy, take care, and until next time, goodbye.